2, 1.
Hello, you guys, and we are back at Tuesday Tips. It's 2024. We made it after the holiday break, but unfortunately, I am late because the OR is busy this week. It's good. I did 4 cases today, and unfortunately, it ran a little bit past the Tuesday Tips time, so I don't have a topic. Because I have to do a short live today because the nanny's waiting. I wanted to come to answer the questions. I didn't want to end the day without answering the questions that you guys left me in the story. And of course, if you have any questions, you can put them in the comments and I'll gladly get to them. So this is our Questions y Respuestas because there's a mixed Spanglish here. There's some questions in Spanish, some questions in English, so we'll get to them. Willie, let's start.
Okay, let's start with this. Do I need to get massages after tummy tuck?
Massages after a tummy tuck, I do recommend them. The only difference with liposuction massages is 2 things. The number of massages, I don't recommend as many as with liposuction. With liposuction 360, you need more massages because there's more area to massage. So I recommend at least 20 for a lipo 360 or a BBL. For a tummy tuck or a mind makeover, I recommend at least 10. Everybody's different. Some people need more than 10, but at least 10 massages. And the main difference is for the first 2 weeks, you're not going to get massages in the areas of the incisions. So the massages are going to be focused on the areas of liposuction, the waist, the back, but not the belly itself. At 2 weeks, they can start massaging the belly because the incisions are well healed.
Doctora, si mi contractura capsular no mejora con singular, ¿cuál es el siguiente paso a un año post-op?
Esto es muy buen tema y puedo utilizarlo para hacer un Tuesday tip completo de contractura de cápsula la próxima semana, porque dependiendo de varias cosas, depende del grado, depende de cuánto te esté molestando y depende, pues como tú dijiste, si ya se trataron otros medicamentos. Si ya empezamos con medicamentos y lo otro que es importante son los masajes, porque hay que ir como que suavizando ese tejido de cicatriz. Si no ha mejorado con masaje y con singular, el próximo paso sería cirugía, evaluando cuánto esto te está molestando, cuánto te está doliendo. La contractura de cápsula puede causar dolor y también puede causar deformidad. So, la semana que viene podemos hablar de eso en detalle.
If someone is HIV positive and undetectable, can they get BBL surgery?
Yes, so I'm going to ask you for a viral load and also a CD4 count to check that the load is undetectable and your CD4 levels are good, and from an ID or your primary care, whoever is following your medications, to give us a clearance that you're good to go. But yes.
¿La evaluación para cirugía se paga?
So, la evaluación inicial no se paga, es una consulta virtual gratuita. El primer paso es yendo al website, al link que ven en el bio. Le dan un clic ahí, eso te va a abrir un formulario que es la consulta virtual. Ahí tú vas a entrar tu información, la cirugía que deseas y también 3 fotos. Bien importante las fotos que tengan buena visibilidad, las áreas que tú quieras evaluar, porque yo voy a estar evaluando esas fotos y con el cuestionario que llenaste determino si eres buena candidata para la cirugía. So, esa consulta inicial es gratuita, hay una coordinadora que te va a estar llamando y te deja saber las recomendaciones que yo di.
Do you give patients any pain meds in the IV before waking up so they don't wake up in pain?
No, you have to just hold it. No, of course I do. Of course I give IV medication. So your surgery is going to be under general anesthesia, which means you're going to have an IV. So during the surgery, you get narcotics, strong narcotics in the IV before you wake up. In recovery, everybody's different. Sometimes those strong narcotics are good enough and people wake up without any pain. There are some people that wake up in pain because they need more, and the IV is still going to be on in the recovery room and we can give you more medication if you need it.
And there's patients that wake up speaking perfect English even if they don't before surgery.
This is a great story. You need to ask Willie what happened after his surgery. Yes.
Yeah. When can you consider a new procedure after a mommy makeover?
So I always recommend to wait at least 3 to 4 months. That time frame, it's depending on your healing. If you had any wound healing problems, any delay on healing, any seromas, anything that happened, then it may be a little bit longer. But if your recovery was perfect, those 3 to 4 months should be good enough to undergo another procedure.
Any tips on preparing for a second round BBL with you?
So what things are important for a second round? One is your evaluation to determine how much fat you have left. If you are skinny to begin with the first round, you may not have a lot of fat. So things to consider is either gaining weight or adding other areas that weren't liposuction on the first round to get more fat to achieve your result on the projection and the hip and buttock area that you want. So those are things to consider. In terms of the vitamins and preparation, it's very similar to the round one. You need to prepare your body. So you're gonna start your iron, your vitamin C, your folic acid regimen at least 30 days before the surgery, making sure your blood work is good, staying hydrated, staying well, a good nutrition so you're ready for the surgery.
Y la última, ¿se puede hacer BBL después de un mommy makeover y cuánto se debe esperar?
Sí, muchas de mis pacientes hacen esta cirugía. Yo no combino la cirugía del BBL con el tummy tuck, abdominoplastia o mommy makeover por razones de seguridad. Entiendo que es mucha cirugía para que te vayas para tu casa y yo hago cirugía en un setting o un ambiente ambulatorio. So, te vas del centro. Entiendo que es mucha cirugía por razones de seguridad. Y lo segundo, la recuperación. Vas a tener que estar flotando por 6 semanas porque no puedes estar ni en tu espalda ni en tu abdomen. Así que yo prefiero hacerlas separadas. Mi recomendación, la mayoría de mis pacientes, es que se hagan el mommy o el tummy tuck primero. Así que tu pregunta recae en que si se puede hacer BBL después, pues claro que sí, porque yo la mayoría de las veces lo recomiendo de esa manera. De esa manera reparamos el músculo, removemos el exceso de piel y así podemos hacer una liposucción mucho más even o equitativa, igual, dejando un plano mucho más igual y que los resultados sean mucho mejores. At least 3 o 4 meses después del mommy o del tummy tuck. Perfecto. Muchísimas gracias por las preguntas. Disculpen que me atrasé un poquito y no pude hacer el live completo, pero la semana que viene hablamos en detalle de lo que es contractura de cápsula para que no haya dudas respecto a eso. Sorry for the delay and that I wasn't able to discuss the topic, but next week I'll be talking about capsular contracture, so bring your questions. Thank you for the questions that you guys left on the stories, and I'll see you guys next week on Tuesday Tips. Have a beautiful week. Take care.